Thank you, Kelsey. Well, welcome everyone to Epidemics of Injustice. This is our 13th session. So we're cranking through the semester. And before we get started with today's topic, I just wanted to give a little introduction about what this course is in case this is your first time joining us. This is an annual course offered in the UIC School of Public Health. And this is the first year of it being sponsored by the Collaboratory for Health Justice. So every week we've been meeting and talking about all of these different topics around our theme for this year, which is resistance, revolution, and rebellion through public health. So each week we've been talking about a different public health topic, as well as different ways that public health intersects with activism and resistance, and really talking about ways in which we can dismantle the systems that create the social and structural determinants of health. So we are really happy to have many of you visiting with us who are not students, and we hope that you enjoy the session today. Before we get started, I do want to acknowledge that UIC is on the ancestral homelands of the Three Fires peoples, as well as a number of other indigenous tribes. And lastly, this course is open to the public, and we want to continue making this course and continue improving this course. So if you do enjoy today, we have set up the Collaboratory has set up a fund for the course to help support this course and make it more accessible for the future. So with that, I will turn it over to our topic for today. So today we are talking about environmental justice. And so with us, we have two folks from the National Resources Defense Council, and we may have some other speakers who join us a little later. But first, I just want to introduce Yukyung Lam, who is a public health scientist at the Natural Resources Defense Council. She has been working with NRDC's environmental justice partners on reducing the cumulative impacts of environmental threats and social vulnerability in low-income communities and communities of color in the United States. And then also with us, we have Malia Gertzma, who works with communities of color and low-income communities to address environmental injustices, combining her background in public health with legal advocacy to support frontline partners. Her focus includes addressing the impacts of concentrated industrial sources and fright on fence-line communities, raising awareness of chronic urban flooding and sanitary sewer issues as environmental injustices, and advocating for local, state, and federal policies that recognize and address cumulative environmental burdens. So I do want to note that this session is recorded. So if you need to play this back, if you need to step away during the session is recorded and will be posted to the Epidemics of Injustice website. So with that, I will kind of turn it over to our panel. So today our session is going to be a little different from previous sessions. We are kind of going to do a more Q&A to learn about the work that our panelists are doing. And so if folks have any questions, feel free to drop those in the chat. We will be monitoring the chat for any questions that come through. And so with that, I will go over to our first question. So for our panelists, could you talk a little bit about what is environmental racism and how does that impact health?
Why don't I jump in first on that one? And I think, so Yukyung is based in New York and I'm based here in Chicago. And I think we referenced this right at the beginning, but I wanted to note that, sorry, I'm gonna get choked up just saying this, but today is a difficult day in Chicago. And I just want to note that and notice it. And to tie it into what we're here to talk about together today, you know, environmental racism in our mind, I don't have the book definition to read from, but I think it's, to us, it is the understanding that people in our country and throughout the world do not experience pollution and the impacts of pollution equally across the board, that like many of the burdens and harms within societies pollution tracks racial lines, it tracks income lines. And not only that, but it usually tracks those things all in combination, so that the people who have the least money, who are most racially vulnerable, and who are most socially vulnerable, tend to bear the greatest environmental burdens. And I wanted to tie that into what I said at the top of the comment, because I think we also recognize that saying environmental racism links the environmental aspect of it to all of the other injustices and burdens that track racial lines. And I think a lot of the community members that we work with really make that connection, that police violence and police injustices are part and parcel of environmental justices. The two are inextricably connected in many instances and are part of the same problem. And to put a fine point on it, I know that one of our advocates has pointed out that the reason that the Chicago Police Academy was cited or proposed to be cited in Little Village is because they have a zoning district for industrial uses, that large parcels that can be used for these kinds of public facilities. And so there's a direct correlation between the policies that keep industrial polluters in communities like Little Village and our support of over policing and police violence and police presence in communities of color. So I wanted to just note that at the beginning, given the broader context that we find ourselves in today in Chicago.
And I guess I'll add to that by answering the second part of that question that Alexis posed. How does environmental racism impact health? And so as Malia mentioned, because of these confluence of factors where people are living, working, playing near very, very unwanted land uses like these industrial facilities, they're exposed to the hazards that those facilities present. And so what we know from the epidemiological literature, and I believe this was also in the background reading, so you may already know this from that or your other work, that there are many very adverse health impacts linked to exposures to various of these environmental hazards. And so, for example, we know that living near locally unwanted land uses, such as industrial facilities, hazardous waste sites, major freight gateways like ports and rail yards, that proximity to living near those sites exposes people to higher risk of health outcomes, including cancer, such as childhood cancers, respiratory illness, cardiovascular disease, birth defects, low birth weight, and other adverse birth outcomes. Living near roadways and heavy sites of traffic, for example, there also is tracked with negative health outcomes. So you have from those things like preterm birth, low birth weight, respiratory illness, cardiovascular disease, many of these very, similar kinds of diseases and long-term chronic conditions. The other thing that I wanted to mention is that, as a lived reality of this experience of environmental injustice, communities know that they're not actually just being bombarded often with just one type of polluting source at a time, right? They're not being bombarded with just one type of facility or one type of pollutant or even one media. It's not just air pollution. It's usually, air pollution, probably, land. It might be a toxic site, a former Superfund site, for example. There may be issues with water pollution in terms of either the drinking water may be contaminated or they may be living in an area that has insufficient stormwater, sewage services, those kinds of things. And so there's this combination of factors. That's what we call cumulative impacts. And I think you saw this in literature, right? So cumulative impacts is really this co-occurrence of these multiple hazards across multiple media at the same time as social and demographic characteristics that can make somebody more vulnerable to the impact, more susceptible to the impact from a given amount of pollution. So the idea behind that is, look, like if you are somebody who's facing, a pound of pollution and you are in a certain, situation, you live in a neighborhood with high segregation, you don't have access to certain health services, you're suffering from other exposures to different kinds of pollutants, your impact from that is going to be different than somebody who's not facing all of those things, right? So cumulative impacts really tries to get at this idea that we are trying to actually recognize this is the fact of the lived experience of communities that live in a situation of environmental injustice. So what we often call environmental justice communities.
And I just want to really emphasize that second point that Yukyeon made, that it's not just you face air, water, or soil pollution, and you face, 5 types of air pollution. It's that those, again, track sociodemographic characteristics that make people more vulnerable to all those combined pollution and pollutants. So there's a synergistic effect enhancing vulnerability so that, for example, I think a lot of folks in public health school often study access to health insurance and how somebody's health status can track very closely with whether or not they have access to medical care and health insurance. And you oftentimes find that the same communities that have the highest pollution burdens and cumulative pollution burdens also have some of the lowest insurance and access to care rates as well. And so again, that's your vulnerability to pollution is going to look much more heightened as compared to somebody who does have access to health insurance, who can easily go see a doctor if something, if they've noticed symptoms starting to occur. And so it's all of those factors together that create the lived experience of the heightened environmental injustices. And I think that can be sometimes lost. It's a really important concept that's come out of community advocacy itself, where people said, these standard tools that all the health scientists are using don't capture the fact that we don't just get exposed to lead. We don't just get exposed to air pollutants. We get exposed to all of it, and we're more vulnerable because we are deprived of certain resources and access to goods within society as well. And I remember Yukyeon said too, there's the concept of the allostatic load, or the just inherent stress of being a person of color in society that actually manifests in health. It can manifest in lesser health, that load, that stress can actually make you more vulnerable to disease and to pollution as well. So I think it's a really interesting concept for our folks who are starting out in their public health careers or might have studied kind of more traditional ways of gauging health and well-being when they were in school, to really think about how we are accounting for what people actually experience out in the world.
Yeah, that was amazing. I think that, referring back to the literature is great, because that's a lot of what we asked the students to discuss before. So I think it'll definitely add a lot of nuance to our discussion. But I did want to introduce our third speaker, and then I'll repeat the question so that she has a chance to answer as well. So our third speaker for the night is Olga Batista for the Alliance for the Great Lakes. So Olga joined the Alliance in 2019, bringing deep roots in the environmental justice community and a wealth of experience as an environmental advocate. She has dedicated her professional career to improving the quality of life in her community of Chicago's Southeast Side, which she continues to do in her role as community planning manager. Olga leverages her expertise as a facilitator, advocate, and thought leader to advance the Alliance's green infrastructure. Sorry, I ran out of breath. Infrastructure initiatives and clean water priorities. As community planning manager, Olga elevates and champions equitable land use decisions. In addition to her role at the Alliance, Olga is a board member of the Southeast Environmental Task Force, SETF, and a mentor to the youth girls organization Rebel Bells. As one of the leading organizers of the Southeast Side Coalition to ban pet coke, Olga helped lead the campaign that won action by federal, state, and local politicians to address pressing environmental issues in the 10th Ward, including Illinois' Attorney General's office, the Chicago City Council, and the Illinois Governor's office. So I would like to welcome our third speaker, Olga, and I will repeat the first question we'd asked the other panelists which was, I'm sorry, I had to change to another tab. What is environmental racism and how does environmental racism impact health?
Thank you so much, Washika, for the intro, and also Alexis for putting this event together, and the team, and my co-panelists that I adore, and I'm always in awe of, Yukian and Malia. I am from the Southeast side, and folks, might know that right now there's this plan to move a metal shredder from the north side, Lincoln Park neighborhood, to the southeast side. And I think that my co-panelists, I was able to hear some of your comments regarding like what it means, to live in a area that is overburdened by pollution, and also, I think you can said this confluence of factors that expose, or that just set people up to feel the impacts of the pollution differently than let's say if this was going to happen in Streeterville or in another community. And I think I wanted to dive in a little bit about so we haven't done enough research, but just this is mostly anecdotal, but like the mental health impacts, when you have a community that it is a residential community and it's right next to an industrial area, and everything that is planned for the community is to support that industry. You start to wonder, like, you start to hate your neighborhood and feel like you don't have a home, like a place where you can actually go that is for you. And the roads, the way the streets are built, huge infrastructure projects like the one that Ford did recently. There's a lot of train tracks around this community because of the, like, just logistically, it is like a hub for moving different kinds of bulk material. And Ford, would have to like go past these train tracks to park all the cars that were coming off the line. And there is a train track that had these long trains, and like those cars that were coming off the line would like back up. They literally dug out the earth and made an underpass under the train tracks to be able to get, so that they wouldn't be held up like that anymore. And it was a multi-year project. They moved an entire street over, actually closer to residential, a residential area. People in that area in Hegwish have complained that the truck traffic and everything has actually compromised their foundation. They're seeing more like seepage, like water, like during this time of year when it's raining, coming into their community, into their basements. And it is a community issue that like managing stormwater and the way that climate change also impacts our community. But you have a neighborhood that generations of people who 40 years ago were kind of thrown out, like out of work when the steel mills one by one shuttered. And that was an example of like, hey, we don't need you no more. And it was nice for that 100 years when we were here and we supplied jobs to this entire community, and it left the community in shambles. And it's just like this like constant attack on working class and working poor in this area, and then you have that coupled with all the other things that we're seeing right now, right? Like this is also a community that is very polarized politically. So there are people who are Trump supporters. We have the second highest voter turnout for Trump, second to Mount Greenwood in this ward. And then very like progressive folks, and hardly nothing in between. It's very, very polarized. There's still a lot of like Blue Lives Matter, thin blue line flags all over. We actually have just around the corner from my house, somebody who has a big kelk flag, which is like what these like the flag that a lot of the white supremacists were using when they, attacked the Capitol. So like you have generations of people growing up being blamed for the demise of the community. Like people, like white folks would say like, oh, this was a great neighborhood until like the Black people moved in, until the Mexicans move in, and completely leave out of the narrative the fact that it was industry that cut out and left like this huge problem for people to fix. So as we're trying to organize and get people to, want to, fight for their neighborhood and for their own families, there is sometimes that resistance or that question that comes up, and it's like, oh, it's always been like this, or things never change. But I have to tell you that in the last year, there was at least four Black Lives Matter demonstrations that happened in my neighborhood, and those organizers took up the issue of environmental racism and started to put them together. And the group of environmental activists and advocates grew enormously. A lot of young people from George Washington High School. You guys, I'm on a call, okay? It's that time of day. Just like go a little buck wild. I just wanted to say that like we're in this moment where folks are connecting these issues and are also joining, like environmental justice activists are joining the Black Lives Matter movement and vice versa. And it's becoming one. It's becoming like a tightly knit group of activists in the last year who are starting to challenge that narrative that, like that this is not our home, that we're not welcome here, that this is all for industry, to say like, no, actually we didn't do anything wrong. The industry and the government on every level, federal, state, and municipal, has failed us and has created a situation where our health is now in jeopardy, and now we have actual data that we can point to that says like this is a neighborhood that has more probability of folks having COPD, heart disease, and it's also a community that is medically underserved. So you have a lot of sick people and not enough places for people to get the help that they need to get better. And that is that's our reality. So now we have a big group of activists and advocates who have the data in their hands and are able to challenge that narrative, and also just at the end of the day bring hope, to a community that has felt hopeless for a long time.
Yeah, thank you so much. And I'm really glad that you've also been able to kind of look and tie it to, there's this historical tie-in, right? That's really important for us to understand when we're looking at issues. It's not just the way we find ourselves now, but why do we find ourselves and how do we find ourselves that way? Rather than just saying it's just this kind of phenomena that just happened in the last 5 to 10 years. So thank you for that. Our next question was, could you tell us about what your organization does and what environmental justice issues they address and for what population? And I know that some of you have touched on that, but I definitely wanted to see if there was some, I guess, more in-depth things you'd like to add in addition to what you said before.
Yukyan, do you want to kick that off for NRDC more at the kind of national federal level, and I can maybe dial down into Chicago and we could tag team with Olga on that?
Yeah, sure. So I think a lot of you probably have been hearing in the news, or at least I hope, that there seems to be, at least in this sort of moment nationally, more attention to the issues of environmental justice, environmental racism. And there have been, executive orders, bills being proposed at the national level that mention environmental justice or climate justice or, environmental justice and data collection. And so there's really actually a lot of activity on these topics and potential solutions that has been exciting to see. And so what NRDC is doing is that on the topic of environmental justice related legislation, really trying to be a good ally and supporter of EJ groups and their priorities. So what we do on this, for example, if there is a bill or somebody comes to us asking, like, for example, from a certain, like say there's a lawmaker, they're interested in designing a policy on something, they come to us, NRDC, asking for advice on, what that bill should look like. What we often try to do is to really elevate the voices and actually stress the importance of there being direct outreach to environmental justice communities and organizations. So I think one of the things we didn't actually quite talk about because of the way the first question was framed was, what is environmental justice, right? And so I wanted to just say that, environmental justice, of course, there's the sort of substantive goal, right, about getting to the point where this huge situation of inequality, inequity that we're seeing that has all these different health impacts doesn't exist, right? That's obviously the substantive goal, but there's also actually quite important element of environmental justice, which is about the how do we get to that point? And in the getting to that point, there are various principles that are kind of recognized as, well, these are the principles. If you are doing EJ work, one should hold oneself to them. And so there are things like letting people speak for themselves. Those who are the most impacted, they should be the ones designing the solutions because they have the solutions, they know the problems, they're the ones with the information, the lived experience. So that's a really important principle in doing EJ work. And so as NRDC kind of participating in these spaces, you see many bills and proposals and these kinds of things. We try to provide the technical support, but really we're there kind of in a supportive role, more so than kind of leading with an agenda of our own. My specific role has a lot to do with the science and data analysis piece of things. So I mentioned before cumulative impacts. So what I have been working on is to look at ways we can improve tools that analyze and really capture cumulative impacts. What are the maps? What are the kinds of data sources? Where are the gaps and how do we fill them if we really want to do a better job of capturing this lived experience? And then going from the tools to the policy making, right? So what are the policies? What are the ways regulations are made that need to change to more accurately take in consideration those results from these analyses? So is it something like, for example, in permitting needs to be done a different way. Maybe permitting, instead of just looking at that new proposed facility and seeing on its own merits how it is, you have to actually say, well, look at the neighborhood it's being cited in. What are the characteristics? What are the already existing burdens of those neighborhoods? And if it's a neighborhood that's already suffering from disproportionate cumulative impacts, well, maybe you should say you can't have that permit, right? No more. So that might be an example of kind of work we would do to get cumulative impacts implemented into actual policy. Another one might be looking at chemical regulation. So for example, when the EPA is setting like what is a safe level of a certain chemical, and let's say that chemical causes cancer. Well, is it just looking at how people are exposed to that one chemical, or are they also looking at not just chemical X, but also chemicals Y and Z that somebody might be exposed to that have the same cancer endpoint, right? Like that would seem to make a lot more sense, right? So there are different kinds of kind of legal policy regulatory levers that we try to kind of get at to really incorporate more of this cumulative impacts recognition.
And so maybe I'll jump in and do kind of a transition between what Yukyeon was describing and how Olga works with us as well. And I'll start out too, because when I was in public health school, I had never heard of NRDC before. And to be honest, I'd never heard of NRDC probably until the year I applied to it. But so NRDC organizationally is one of the US's largest nonprofit environmental organizations. And it has about 700 people employed by the organization. We have offices in several cities in the US and also in China. And we employ a lot of lawyers, we employ a lot of policy people, lobbyists, economists, those kinds of scientists like Yukyeon. And I want to also just recognize that NRDC, the organization, does not do the work that we do by and large. It is, our team, the environmental justice team, is about 8 people within those 700. There are definitely teams that try to take similar approaches to work of social injustice. There are lots of people who focus on fair housing, on access to clean energy resources, taking a social justice lens. So I don't want to say that the rest of the organization is doing something else and we're doing the EJ work. That's not it. But I just want to recognize that, because there's also been a lot of conflict within the environmental movement between the quote big greens that tend to take up space and that for many years have not focused enough on social justice and racial justice, and the environmental justice frontline advocacy and frontline groups for whom that is the absolute key and first line order concern. So maybe with that background, I'll say that as the environmental justice team, we are a subset of people who, as Yukyan described, try to abide by both process steps that recognize and center the experience of people out in the world in real communities who are experiencing these burdens, and also to bring the kinds of training that we have to try to create solutions alongside those individuals, and to try to come up with strategies together. So maybe to put that in some more practical terms, describing some of the work I do in downstate Illinois, and then maybe Olga can sort of pick up more of the work we're doing in Chicago. So we've talked a lot about industrial facilities. I work with a community in the East St. Louis metro area, just across the river from St. Louis, that by and large is not industrialized itself. It came about in part to serve the industry, the very heavy industry that basically decimated the East St. Louis metro area for many, many years. But this community is slightly on the outskirts of it. It's very residential. And it, for decades, has had a completely dysfunctional sanitary sewer system and stormwater system. So people for decades have been living with flooding, even in the most minor of rains that will basically make it impossible for them to leave their homes. They have raw sewage that will just constantly flow on their lawns, even when there is no rain. So just from basic use of the pipes and the plumbing in their homes. And not very surprisingly, these people are, I think the community is something like 95 to 99% Black. It is extremely low income. Many of the people there are retired and are living on fixed incomes. And what they would say is basically similar to what Olga described. When the industry collapsed in this area and just left, the white people also left, and the jobs left, and we remained. We were the only ones who were left in this area. And all of the basic infrastructure that in any normal society should exist for everybody also collapsed. And so again, for decades they have been living with this, and nobody has helped them. Nobody has said, this is a problem that is our problem too, and we need to go out there and we need to fix this problem. And so NRDC was approached to connect with these residents by 2 attorneys, themselves both Black women, who were doing more traditional legal services and housing assistance work, one on the St. Louis side and one on the Illinois side, who had been, I think in one instance, they'd been helping a resident with bill payments, right? Because that's what you do in more standard legal services. People have bill issues, you help them get those addressed. And she was talking to the man, and he happened to say something like, well, I don't even know why I have to pay this bill. It's not like I get any service for it, for his water bill. And she said, what do you mean? And he said, I've got raw sewage. I've got poop on my lawn. I've got toilet paper all over my lawn. My house floods every couple of weeks. And so she went out there and she just saw the horrific conditions in this community. And she's made it basically a personal mission. She and her partner over at the housing organization have themselves been the boots on the ground and a lot of the legal thinking and organizing energy. And they work day to day Like literally, they just went out to a birthday lunch with one of the residents, but they have been the on the ground presence who work hand in hand with these elderly residents day in, day out. We've been on the case for 2 years. They've been there, I think, for maybe 6 months longer than that. And then we, you know, because we're in Chicago, we can't be there every day. And we do a lot of our connecting through those 2 women, as well as some engagement of the residents directly. Prior to the pandemic, we would make trips down to go visit the community, to go around and tour, to listen to what they had identified as the issues, to ask them questions, to talk about what they want to see. And now we do that in a much more limited extent through, they have, the residents have actually, with the help of these 2 women, organized themselves into a committee that's just grown and grown. And so they have bi-weekly meetings of the committee where they discuss their problems. They discuss how they want to be prioritizing things, how they want to operate, what kinds of actions they want to take. And we've come to call ourselves the support team, because we're the attorneys and the scientists. There's actually a group of physical scientists, so like geologists, water scientists, who are also trying to help. There's some historians who have mapped out the history of how this community basically collapsed and was left behind along very racial lines. And you know, we oftentimes have students who come down to do on the ground work. There was one summer where I think they had something like a dozen students in residence through various schools, helping out the community with various aspects of the work. And so that for me is, you know, both in many ways very deeply embedded work, but also strangely removed from it, because I don't personally have the ability to go down there and meet with people face to face, and didn't even before, you know, we were in the COVID times. And I think so that maybe describes a little bit about the engagement. What we have been doing is, so those 2 women had filed a lawsuit. There are additional, against the local utilities, there are additional attorneys who are working on filing additional lawsuits. There's a lot of fact research and legal research going on to try to figure out which of the many, many entities, including government agencies, who are responsible for the conditions, that we might hold accountable through the courts, but also looking at what kinds of policies have essentially enabled this to happen, and not just by accident, but because, you know, people either intentionally never wanted these programs to assist communities like this, or because people never bothered to think about whether or not the programs would help them, and so design them in ways that just couldn't help them right off the bat. And so I'll use that to transition over to Olga, because the work that she and I have done together over, God, what is it, like 8 years now, is very different, because we get to talk to each other now basically daily. And when we were able to meet in person, we would on a pretty regular basis. And so she is one of our connections to the Southeast side, one of its critical spokespeople, and she can describe more of the work that we do together and what she also accomplishes on her own on behalf of the community.
Thank you. I mean, I've heard these stories, and I feel like it doesn't hurt less, you know, to know that our government would allow these kind of things to happen. Thank you, Malia, for your strength and the work, especially, you know, doing a work that just a lot of folks shy away from, because it takes generations to fix. And there's another reason, well, I won't go into why I find our elected sometimes problematic too in this issue, but for the last couple of years at the Alliance for the Great Lakes, I've been helping really unsilo land use, permitting and zoning with an advisory group that has been advising on a data book. The city of Chicago is going to start to do an industrial corridor modernization initiative in the Calumet River in the southeast side of Chicago. But it has already started this project. Every like 20, 25 years, the city has to reevaluate zoning in industrial areas. And I think they're behind right now. But anyways, when they started this under the ROM under Rom during his administration, they didn't start where there was like manganese and pet coke or, other issues in other parts of the city where there was like a crisis situation. They started on the north side of Chicago. They did the Kinsey corridor, Ravenswood corridor, and then they did the north branch of the Chicago River that downzoned the area where Lincoln Yards is going to be built. It's like a $6 billion development, $1.3 billion are coming from our own tax dollars through TIF. And they went through, they were able to downzone that area to make it so that other dirty industry would not be allowed there anymore, basically to create a playground for the rich with enormous, towers being built for housing, a river walk, and all the rest of it. So the idea was that we were going to start early and organize community organizations that work on different quality of life issues and start to demystify land use, permitting, and zoning, and also have them guide the research that the working group was doing to create this data book that the Department of Planning and Development would use. And we were really focused at the end of the day, after speaking with the different community groups, and especially the folks working on different environmental issues, it was decided that we want to focus on the public health impacts in this data book. And that's basically what, oh, thank you, Alexis, for putting the link there. We're really excited too, because it's been downloaded hundreds of times already. We know people are actually reading it and using it, and we've had over 900 visits to the landing page since it's been released in late February. So that's the work that I've been doing with the Alliance, and it's been very challenging, because the last year when we were really hoping that this last year we would be able to do public events and meet in person and do have luncheons and do all the things to build community and to be able to build trust and relationships with folks that usually don't get involved in environmental issues. And those events all had to be canceled, obviously. And we've tried to do some stuff online, but as you can imagine, it is a little difficult. And no offense to folks who will have their cameras off, but basically that's how it would be. We would have meetings, everybody's cameras off. We don't really get to know each other and connect in a real way that is really needed in order to undo some of the things that we're experiencing in this community. But before I came to the Alliance, we have already been, the community groups that I belong to, like the Southeast Environmental Task Force, has already been involved in quite a few environmental justice issues, and always right in the in the same area where General Iron is trying to relocate to. 10 years ago, they were trying to put a coal gasification plant called Lucadia there, which was a fight that we actually lost. We were trying to stop it from passing in the House and the Senate in Springfield, and it actually ended up getting vetoed by Governor Quinn after we sent him over 20,000 pieces of mail, postcards and letters. Entire schools were having their children's, the children at the school send notes saying we deserve better, and drew drawings and sending those things. And so I feel like that's how environmental justice has shown up in our work. It is really trying to build agency. And when we created this, back to the Alliance, is we talked at length, with the idea of what we were trying to do. And we're we need to fund the organizations that are going to be participating in this advisory group, because sometimes what happens is there's a lot of planning efforts that are led by the city or different groups, lists, other things like that. And they get these groups to come together. People share their information, their everyday experiences and what they would like to change. And then there's not a lot of follow-up. you know, they don't really get compensated for their time. And it really hurts, you know, to like have to be vulnerable and talk about, you know, just how you feel failed by, as a member of this community and all the rest of it. So we try to do something different at the Alliance, and that's fund those groups and the partners who are helping us create the data book and advise on it, so that we show, you know, like with hard cash, like we value you and your insight and your expertise.
I think that's a great kind of transition to our next question. So in this semester so far, we've been talking about all these different ways to create change and to create systems change. And so we've talked about grassroots organizing, mutual aid, writing policies, direct action. So we are really interested to hear about what strategies you use for your work. And then kind of tying together some questions that were put in the chat. What does it look like to engage with people who have that lived experience? And yeah, I don't know who wants to try and tackle that first.
I can jump in really
Okay.
quick. All of them.
I was gonna say, I mean, maybe our work does all of it, right? It's not that each one of us does all of it, but I think what's really interesting about the Chicago work is just how multifaceted it is, because I think everybody realizes that none of those tools on their own is likely to carry the day. And we're finding even together, oftentimes you don't get the outcome that you're hoping for. But you know, maybe to give one example. So again, I was describing, we do a lot of the legal work, kind of coming up with potential lawsuits that we could bring, or regulatory changes that we would want. But then folks probably are very familiar with the hunger strike that a number of the community advocates on the Southeast side decided to undertake. And that is not something that anyone at my organization that I'm aware of has any expertise in. And in fact, there's a lot of lack of understanding of the use of hunger strikes as an advocacy action, that produced a lot of very interesting discussion internally to make sure people understood the origins of the hunger strike, the reasons for it. And I think, you know, it was one of the most powerful tools that the effort so far against the relocation of this metal shredding operation has seen. You know, I can write as many comments, you know, as as I can put on paper in whatever time I'm allotted, but to have somebody basically say, I am putting my own life and health on the line here because I am not being heard, is one of the most powerful things you can do. And so I think, you know, the attempt is how to knit those together, how to bring all of those ways of advocating and making people's voices heard and reforming the system to the table. And I think, to maybe reference back what I was saying earlier about big greens being dominating, I think there was probably this hierarchy and sort of a view that, you know, NRDC's way for many years is the way, right? That we do this kind of inside technical game. And I think there's been a lot of recognition, you know, I'd say over the last decade, but certainly in the last few years, that doesn't get you where you need to be. And it certainly doesn't get you where you need to be on social racial justice issues. And I think there's a lot more recognition that the tools of organizing have to be part of the campaign, and there has to be recognition of valuing and coordination among the work that we are doing. So Olga, I don't know if you want to jump in on some of the direct tactics, or
yeah,
how they, you know, how they connect with other tools.
Like the hunger strike, you know, we initially thought that we were just going to have the 3-4 people who said they would do it from the campaign. And then as the days went by, more people started to join, people that we didn't know. It totaled up to, I want to say like 13 or 14 people. There was people that were on a hunger strike that were like they were just on their own, that had not really that didn't really check in with us, but we had to actually hire somebody and quickly fundraise to have someone that was just going to be connecting the medics to the hunger strikers to like make sure that they had their vitamins, make sure that they were taking their blood, they had like cuffs for their blood pressure, taking their weight and things like that, and also testing to see if they were dehydrated or not. So it was like definitely it was hard. It was 30 days altogether. There was a few people who did the entire 30 days, and especially like after, I want to say like after day 10, it was just like a constant worry of, are people okay? Do they have what they need? Are they downplaying their, their symptoms? And the people were in excruciating pain. People said they would have cramps in their legs, and in their muscles and different parts of their body. They would just cramp up like Charlie horses. And it was so hard to try to care for everyone and make sure that everybody was okay at the same time as we were like trying to hold the city accountable, at the same time as we were organizing protests at Lori Lightfoot's house, at the same time as we were like trying to keep track on the HUD complaint, the civil rights complaint. So that's another thing that groups from the neighborhood did, is file a civil rights complaint to HUD, stating that this was environmental racism, that in one hand, on the north side where General Iron was at, their property values are going to improve by removing this company from that area, and then our property values would continue to be impacted and be lower. And that's a case that's still ongoing. And then also similarly, there was a civil rights complaint filed to the EPA regarding the IEPA in Illinois for giving General Iron the first permit that kind of like got the ball rolling and got them, once they had that permit, then they were able to apply for their permits on the city side. The other thing is that, one thing that was different was that we had public health professionals who actually reached out, who, because in the city of Chicago, I'm still talking about General Iron, like the city has disbanded the Department of the Environment during Rahm's time as mayor to save the city money, and like divvied up all the responsibility to different agencies in the city of Chicago. So it's the Department of Public Health that has to issue the permits. And, the public health professionals that helped the city write their plan, their Healthy Chicago 2025 plan, have raised concern and said like, look, we helped write this plan, and like you're totally doing the opposite. You said you're going to address racial disparities. This environmental justice is one of those things, and you're not doing what you said was in the plan. And they felt like they were being used, like we don't want to give you cover. Like basically these public health professionals were saying like, we're not going to give the city cover. And we want to hold them accountable to their plan. And they wrote a letter, and we were, helping with this as well, over 500 doctors and medical students who signed on to the letter, and 70 different organizations. And this is the letter that actually got Dr. Arwady to respond. Like when her peers are saying you're full of shit, and we need you to we're going to holding you accountable to what you're doing. And the fact that you have allowed General Iron to get so close to permitting is a huge problem. She responded to that. She did not respond to 15 people, 13, 14, 15 people on a hunger strike for 30 days, some of them, so you have to use all of the tools in the toolkit. And it wasn't easy either, like working with the public health professionals, because this is a little bit outside of what they do, like to be involved in direct actions and like doing these kind of letters. And then I think it's important for all of us, to also get out of our comfort zone, because, the saying, right? Like we didn't get this far to only come this far. Like we actually, okay, this is thinking about like all of a collective effort from the researchers, the people who write policy, for the activists, the advocates, the people who are running for office, you know, to challenge the decision makers on these issues, like all of that effort. And we are still in a situation where like the city is still not moved to actually take action, even on their own data. Like that should concern every single person on this call, and also motivate us to do something that we are not already doing. So if that means like showing up for Adam Toledo's vigil, you know, if that means like creating your own letter to send to, you know, the public health officials to take those risks, to support candidates in the communities, you know, if that means door knocking, writing signs, joining the Twitter storms, all these things, like it might seem like such a small thing, but it actually is really important. Like we really need to figure out how to unsilo the work that all of our groups are doing, and to be more in community with each other, with that goal that like we cannot allow the city of Chicago, the third largest city in the US, to continue these kind of practices. Like if it cannot happen, you know, this is not like this is not a Republican governed city or state, right? This is a democratically controlled city and state. And if we can't see the kind of reforms that are actually going to put people's health in states like ours, in cities like ours, then what is the hope for the rest of this country? And we have to make that argument. And I think Vice News, when they covered the hunger strike, they said that's how they framed it. And that was the first time that I heard like the framing saying like, hey, we need to take the Biden administration to task, because now we have a president and the vice president who ran an environmental justice platform and like were calling out all of the crap that Trump was doing, all these Republican governors and mayors were doing across the country. Well, now they're in power. And if they're not able to intervene and make sure that justice is, environmental justice is realized in Chicago with General Iron, then it's all the same old of elected officials talking out of both sides of their neck.
Maybe that's a good segue to the barriers discussion. And feel, you know, you can, and Olga, both feel free to jump in on this. I think, you know, one of the things that we struggle with are the 3 levels of our government, right? And the fact that so much of the decision making that impacts daily lives is made at the local level, and there's very little oversight or control of that to prevent huge disparities in people's living conditions. And I always say that you know, when I talk about the flooding and sewage issues that I'm working on, you know, I don't know that people really think about it this way, but in most of Illinois, your water system is kind of like the public school system, right? It's all funded locally. And for that reason, communities that are wealthy have very well functioning water infrastructure. Communities that are poor do not. And there is no oversight at the state level to ensure that everybody has a minimum level of a functioning water system. And so when you go to the state and the federal government and say, how can it be that, again, as Olga points out, in a quote unquote blue state like Illinois with 2 Democratic senators, how can we have a community like Centerville that looks like the worst of the rural South? And you say that we are this, you know, great progressive, you know, stronghold in the Midwest. How can that be? They say it's the local officials' fault, right? They've messed up. There's no money in the community. It's their problem to solve. And I think too often we see that the structures of government work against people's interests instead of for them. And I think a lot of what our work is doing is trying to invert that using of the 3 levels against people to use them to work for them. And so, for example, you know, a lot of federal policy is not necessarily informed by the real conditions in which people live. So if we can basically say, look, this community can't afford to take out a loan to fix its system because it can't afford to repay the payments on that loan, then it needs grant money. And so it doesn't matter how much federal money you pump into the loan program for water infrastructure, you need to find them grants, and you need to make that accessible to them, and you need to make it accessible like yesterday, right? And so I think, again, you know, we're also at this point, to Olga's point about General Iron and the state letting the permit go through, the state pointed its finger at the city of Chicago and said it's actually their fault for allowing it to locate there in the zoning. We're now in conversations with the state about trying to create a process at the state level that would create more accountability at the local level for those types of decisions. So it's not a, you know, it's not a perfect system by any means, but also it doesn't have to work the way that it does. And I think we're fighting some of the same fights, again, that a lot of advocates are fighting in other spaces like public school, like housing, where again, the split of decision making at these different levels has actually been used and abused to ensure that some people do not have a baseline healthy existence, and that huge disparities continue to exist. And so our job is to highlight why that is, to point at that level of government and say it's broken in these places. You can actually change that. And I think for a lot of people too, who, to Olga's point about us coordinating better in community with each other, some people are not trying to fix the broken levels of government. They're trying to seek an entirely different system of government. And I think we also have to recognize and challenge ourselves to not always be working within the system that we've been trained and raised to assume is the way that how things should be structured.
Oh, sorry. There. Okay, perfect. Sorry. I was like, wait, is my mic on or off? I couldn't remember. So I know that Olga said that she did have to hop off. So I do want to just soon. So I do want to ask the next question, and she can go first if she wants, if that'd be better. So what are some outcomes you've seen from your work, and how does your advocacy address environmental racism? And could you provide an example of kind of how those work together, or further examples, because you definitely have throughout your talk?
I think there's 3 dynamics to like the progress that I'd like to focus on. And, you know, like one is the actual results. Like, is this what the community wanted? Is this what the organizations that are working on these issues wanted? Was it high quality results? You know, also the process I think is important, you know, the way to think about like, was the process to get these results something that was easy to understand, that people were able to understand clearly, participate in? Was it clear from the beginning, like what it was going to take, you know, to participate in this work? And then lastly, it's the relationships that we build, you know, and I think that, like I mentioned earlier about, you know, uniting with Black Lives Matter movements and folks who are fighting against police brutality, and connecting, you know, those root causes of like the devaluing life, whether it has to do with police brutality or with allowing chronic polluters to continue to exacerbate, you know, the poor health outcomes that communities like ours face. But because I think like the goal to actually have like a just, you know, community, a city, a state, a country is something that's going to take a long time, right? Like that, it's not going to happen. You know, we're not going to fix all the problems. So focusing on these 3 dynamics, I think helps us see like, okay, well, we are now in touch. Like Alexis was one of the partners that helped do the focus groups for the data book, and like developing relationships with Yukyan and Malia and like the public health officials, and like those relationships are extremely important for us to be able to maintain and to build that community, outside of just the neighborhood, that can help hold those decision makers accountable. And some of the things that we have won, like in 2013, when I started working with Malia, we were engaged in a fight to remove enormous piles of petroleum coke from the Calumet River. And we won that, like the company is still here, but they cannot have these piles stored outdoors anymore. This was also a very powerful company. This was a company owned by the infamous Koch brothers. KCBX was the name of the company. And they are now bringing the bulk storage, the bulk material, pet coke on trains, going directly to a hopper and closing everything, dropping it into a barge. And then that's it. There's not like the kind of truck traffic that there was before. The air monitors, before they were taken out, showed just like drastic difference in like the the amount of emissions. It's not perfect, but it is an improvement. There is the fact that the city has pretty much recreated Yukyan's and Malia's cumulative impact map and made their own cumulative impact map and published it in their air report. Like imitation is a sign of flattery, right? So we should take that as like, it would have been great if it was our map with our, credits there, but we will take it. And that is also a win, right? Like the map is now part of the city's air report, and they have identified 4 things that they're planning to do. One of the first things is to do a cumulative impact analysis. When are they going to do that? I don't know, but it's in writing. It's on their website if anybody wants to look at it. So those are all things that I think my co-panelists and I, worked really hard to try to move that dial over, but also the Chicago Environmental Justice Network that's made up of folks like Little Village Environmental Justice Organization, the folks fighting the matte asphalt in McKinley Park, and Neighbors for EJ, Cheryl Johnson and her team at the People for Community Recovery, the task force, my organizations, Blacks and Greens. There's all of these groups that have been coming together for some time now to make sure. First, it was about accountability, like, 'cause they would say one thing to one neighborhood and then another to another neighborhood. So now one of the reasons why we started to meet was like, well, that's not what they told us. And, we're able to exchange notes, so to speak, about like how the city's doing stuff and holding them accountable. It also scares the shit out of the city when we all show up right together, like and support each other for meetings. They're like, oh, you're here from the South Side to talk about the Little Village issue? I'm like, yeah, we're here. It affects us too. So I think those are all wins, that sometimes we don't even have to say anything. We just have to show up to some of these city meetings, and then they are afraid, about, getting sued and what they're going to do next. But like I said, it's not enough. We still have a long way to go. We need more leaders. We need more funding to be able to support the leaders and development of new leaders, and making space for people to learn and so we could pass that torch to the next generation. It's going to take a lot. So, but I think a lot of us, I actually joke that I never planned for this to be my career, but there's so many issues in my neighborhood that I think I'll have, and unfortunately, it's sad that I'll have work for the rest of my life on these issues in my neighborhood. And I'm going to have to jump. I really appreciate you all. Thank you, Alexis.
Thank you so much. It's so good to see you. And every time I hear you talk about the work you do, I'm just like mind blown. So thank you for your work. Thank you for being here and sharing your amazingness with us.
Oh my God. Thank you. Bye-bye.
Maybe
So,
on the outcome.
yeah.
I was just going to say, I know there are a lot of folks who are in public health training here, and since Yukyan and I both ourselves have degrees in public health, maybe to unpack a little bit more what Olga was describing of some of the work at the city level. So before Yukyan and I started working together, Healthy Chicago 2.0 didn't even mention environmental health that we recall. They had like the safety portions that are pretty standard where they talk about, you know, things like safe streets and that kind of thing. There was no mention or recognition of environmental racism. And when we started working together in collaboration with Olga's group and some of the other community groups, we started asking the Chicago Department of Public Health, like, why isn't any of this even recognized in your core documents? And have you guys even looked at the data? And are you even familiar with the concept of cumulative impacts? And this was maybe 2016, 2017. And you know, the commitments that are now embodied in Healthy Chicago 2025 that I'd encourage you all to read came about because a bunch of us just started sitting down with CDPH and walking them through what's out there that they are not even looking at, the data that's out there, the thinking, the advocacy, the frameworks for evaluating and addressing environmental health issues and environmental injustices exist, and they just didn't know about it. And you know, I wouldn't say miraculously, but there were people inside who heard and who cared and who started saying, you know, this is very consistent with the broader incorporation of social determinants of health in our work more generally. And we want to recognize it, and we want to uphold it, and we want to reflect it in our guiding documents. And so what you'll see again is that environmental health did make it into Healthy Chicago 2025, whatever the formal title is. You'll also see that the department has revised the health atlas to now include things like air quality metrics for the city, and heat indices and other things that go to environmental conditions. And that's not just because somebody in the epidemiology department woke up one morning and was like, I'm going to see what air quality data there is out there and stick in the atlas. It was because for years, literally, we went to the meetings and we sat down with them and we said, you can't leave this stuff out. This has to be in there and you have to recognize it. And I think that's, you know, those are the types of conversations that you guys can be trained and enabled to have. Within this framework of, you know, an agency and its data analysis and its commitments to programs. But the other thing I'll note, you know, being in many of the meetings that led up to the Healthy Chicago 2025, you know, the way in which the public health community got it and recognized it and welcomed that discussion was really impressive too. Because again, these are people who are all sort of focusing on their issue, right? Either maternal child health or obesity or tobacco prevention or AIDS, or, you know, the things that are more the core public health focus areas. A lot of them, it just resonated with them, right? Because this is what we see across public health disciplines, that it's not just about, you know, a person and his or her personal choices, right? It's about the conditions of where people live and the things that are beyond their individual control. So I just wanted to make that really clear in case folks are kind of wondering, well, how is my training going to help me, you know, make a difference in some of these areas? It can really move the dial in some incredibly important ways. And that what we found is, you know, data matters, but also what we're doing is trying to connect the data with the stories, with people's narrative, with the experience, and say, well, what does the data leave out too, right? What are we not capturing when all we do is crunch data and run, you know, chi-squared analyses and all that kind of stuff? How can we capture that, you know, bring it to light, analyze it, give it weight in these decision-making processes? So I think that's a really interesting question for folks who are in the public health discipline. And I don't know if, again, you want to say, or if we have time to say a little bit more about that, because I know it's a really big part of your work.
Yeah, I don't know. I think what I have found going through, like, at least in my sort of PhD in public health training, is that the School of Public Health, it seems like especially on the environmental side, the methods that are used tend to be very heavily quantitative, right? Like it's quantitative. It's like if you can't measure it, it doesn't exist. And I don't know really, is that changing? To what extent is it changing? And it's more like in the study of things like mental health and even HIV/AIDS, that the importance of qualitative research methods is actually elevated. And one of the things that I'm like very interested in is like, how do we actually bring that together? Because, and as I think there was a question before, it's like, how do you engage people with the lived experience? So one of them is to recognize that they are experts of that lived experience, right? So there has to be a way to capture their information, their data, essentially. One of the things that we were working on in the context of Illinois, for example, was there was this tool, I guess, this analysis that was supposed to help identify communities that could benefit from the Illinois Solar for All program. So they decided, okay, we're going to have this method of identifying these sort of priority communities that might get more points if a certain project is proposed in their area. And one of the things that we said when we looked at the proposal was, well, how about a way to actually, give weight, as Malia was saying, to qualitative data as well. And so, we made some proposals. They came up with some final language. It wasn't quite what we were looking for, but they did have a little bit of the idea in there. And if you look at there's a bill now that is being proposed. It's called the Environmental Justice and Data Collection Act, I believe, of 2021, maybe 20. Yeah, I guess. Was it reintroduced this section? I'm not sure, but it was introduced by Senator Markey's office, and it actually has in there like a number of indicators, both environmental justice and climate justice indicators. Somebody also asked that question, but we were working with the staffers on that language. We actually got them to put in a provision that said essentially, to include in any kind of cumulative impacts analysis or mapping tool, the inclusion of qualitative data, especially for environmental issues where quantitative data are just lacking. So, they actually gave some examples, even said things like tribal sovereignty. There's certain issues there that you might just not have really good, nationally available public quantitative data sets. So that's something that we're definitely working on, is really just trying to like elevate the voice. And so I really encourage people to really think about that in their own work. It's always a tough one, right? Because it's like lack of data has also been used as an excuse for inaction. So you don't want to like sit on your hands and be like, well, there's nothing out there. And then somebody's like, well, since there's nothing out there, I don't really know what's going on. I'm not going to make any policy, right? But obviously there's like a line to walk and a balance to be struck.
Yeah, I think that's some really good insights. And I know we're moving along with our time here. So I'm going to kind of condense our last two questions that we had for you, because I think we've kind of touched on them both. So our fifth question was, what are some structures and barriers to outcomes? And I think related to that are, what are things that public health researchers or practitioners, I know we have some folks here who are doctors or nurses or researchers, what are some things that we can do to support your work and really contribute to this systems change that you've been talking about?
I think you heard a lot from Olga in particular about the power of those letters that the health community and the medical community came together to write. And again, these are people who are all connected through professional channels in a lot of different ways. And I think it was the frame of the issue really resonated for everybody. And I know it's difficult, and maybe Yukyun can talk to this as well. Oftentimes, I think we're told that scientists need to be objective, right? And that means not taking positions in difficult advocacy circumstances. And a lot of people who are in the science fields will shy away from getting involved in policy because they think it will somehow undermine the view of their expertise, because it'll seem tainted or biased or something like that. And I think we have a number of scientists on staff, and it is a struggle for them at times, right? Because I think there is this perception that we're just advocating for a certain viewpoint that may not be based in the science, quote unquote. But yeah, I see in the chat, public health is political. I think, all of us know that none of the studies will give you the absolute clear answer about what policy you should adopt, right? There are always going to be uncertainties that are left. There's always going to be a value judgment that you have to make when you're left, when you get to the end of that epi article. And I remember one of my classes on environmental epidemiology, we were given studies, and then we were challenged not just to evaluate the study, but we were told, imagine you are now a regulator at EPA. Do you have enough information to comfortably make a decision about what to do about this problem in the real world? And that was an extraordinarily helpful exercise to go through in training, because it reminded me that at least for me personally, I think for a lot of people who go into public health, I didn't want to just do the research and just put it out into the world and be done with it, right? I wanted it to make some kind of a difference. So I think those are all really important things to keep in mind, that you are going to be challenged to voice your opinion, to take a stand on these issues. And I would encourage folks to do that without too much concern that your voice is going to be discounted because you do so.
I'd like to add a couple things too, just from what I've observed. So there are obviously very large professional, health-related societies like American Public Health Association and these other things, right? And historically, communities have not been invited to participate in those spaces. And it is a source of great frustration for them when especially they would want access to the knowledge. And also at the same time, a lot of that knowledge was created because these communities allowed themselves to be quote unquote studied. So I would say that this issue of access is one that actually we've been working on with APHA for a number of years. And it's really frustrating because when you charge hundreds of dollars to participate in the conference, right, or the membership, it's just ridiculous. So there really needs to be a better way forward. So to the extent that anyone has any participation or a voice or anything in that, that would be really helpful. The other thing that I'm noticing that I think has to be said is because of where we are in our political moment and so forth, this issue of justice and equity has been elevated, which is very good. That's a good thing. However, at the same time, there also has been this proliferation of studies on quote unquote equity, or claims being made oh, this policy is going to benefit equity. And I would kind of invite all of us to also be super cautious when you see those kinds of claims, right? And when you go about, even maybe yourself, somebody has asked you, hey, you have this technical expertise, can you study the equity benefits of this? I'd like you to model this or whatever, right? And remembering always that okay, if what you're trying to do is a justice focused thing, that definition of equity, what actually counts as a difference is something that we need to, a meaningful difference, need to make sure whatever is that delta that you are, you've modeled, there's a policy and it has some whatever change, that has to be something that's meaningful, both from a public health point of view, right? And it also has to be meaningful in terms of something that the community is actually seeking, right? So what I mean by that is, for example, if you're looking at, air pollution, right? And you say, oh, here's this policy, it reduces air pollution by X%. Well, even if on paper that X%, you're oh, great, that, then maybe there's some benefit there in that X%. But if you think about what that X% actually means in terms of what the community is living and what they're facing, and figure out if that number is actually significant, that's much different place than just saying, oh, well, you have some number there, right? And that it's, it's a statistically significant number, and that's all we care about. Like I said, the environmental justice work means letting people have a voice, right? Not being the ones that are leading. So I think that any kind of work, you really need to, ideally, any kind of study that makes any claims about equity should be done with the community very closely. So just wanted to make that point, because I know there's a lot of this going on right now.
Maybe just a couple of other points on kind of some of these research and collaboration-based issues. When Yukian referenced communities feeling studied and not really, and then left. And I think that that's a very common thing in some of the fields that we work in, where we kind of dive in, we get the grant, we go in, we do the study, and then we publish it, and then we leave. And I think one of the challenges is to think about how to invert that practice as well. Again, how to do collaborative research that the community itself is asking for, but more so too, how to make sure that there's value left when the study wraps up, and that you're not just extracting value that gets put out to some conference, but that you're leaving something that's very meaningful. And I think one of the most interesting things for me in doing the work downstate on the water issues is that, we talked about how the value that we could help bring isn't even necessarily in our primary areas of training, right? That we helped the residents organize into a group. I'm not an organizer. I don't, that's not my field. But I think there's recognition that, if any of us goes away, there needs to be some way in which they are coming together and able to operate without us. And there was also recognition that while we may be working to solve the sanitary sewer issues, nobody was drinking their water either. And so, even though I'm an attorney, we started working on ways to get bottled water to people and to raise money for bottled water. And so again, I think there's this recognition that you may enter a community because of one compelling issue that catches your attention. But when you get there, you're going to find a lot of other things. And I think part of our responsibility is to not stay kind of in blinders focused on the one issue that brought us in, but to also figure out how else we might be able to bring value there. And I will say, one of the hardest things to do is then also figure out how to draw your own limits so you don't burn out. And I think, a lot of us, that's an extraordinarily important personal and professional question that we have to draw. And I remember my mentor in my legal services clinic, in which I helped patients with AIDS write wills and trusts and guardianships for their children. And she would say, my personal choice is I'm their attorney. I care deeply about them. I see the conditions in which they live in. But for me to be able to come into work day in, day out and to provide them the specific service they're seeking from me, I have to draw that line at I'm going to be their attorney. And she said, this is in comparison to my colleague who will go into their house and bring gifts and try to get them food assistance and do all these things that are outside of her role. And that's how she does it, right? So I think also, especially to folks who are used to giving and who might find themselves depleted over time, or for whom this is hard work. And I just want to recognize it and also say it's okay to draw your own limits to protect your own well-being and your own ability to keep at it, because it's not a sprint, as we've been talking about. Nothing about this is going to solve the problems tomorrow, and you got to make sure that you're healthy and okay to keep at it.
Yeah, absolutely. I think that's a great landing point. This is just so important, and we're, all semester we've been talking about all of these different tools to use and all of these different injustices that manifest in so many different ways. And so I kind of echo that, and encouraging folks to think about what tools you have at your disposal, how you can use them, but also using those in creativity and in balance in a way that works for you. So with
also,
that, yeah, go
I
ahead.
was gonna say also those who can see the chat now to copy the links, because knowledge is power, and to see that. And for students, you'll be able to see the chat tomorrow on Blackboard. But yeah, I know Alexis and I wanted to thank our speakers for coming. You've given us so much valuable information that we're going to be talking about at home, at school, for a very long time. And we really wanted to thank you for coming today and sharing your knowledge and your passion with us.
So with that, we will conclude our session. Thank you so much. If you are registered students, stay on. We'll come back at 7:10 to have our discussion on the readings. And the rest of folks, thank you so much for coming. We hope to see you next week. Our topic is disability justice movement. So Ms. Torres will be sharing about her work and her expertise. So we hope to see you soon. Be well. Feel free to turn on your cameras if you would like. So I know there were, I guess before I talk about that, I know today's been a rough day for some folks. So if you don't feel like talking, you will not be penalized for lack thereof. So just, take care of yourself, do what works for you. But I do want to kind of make the last 20 minutes, hopefully, give some space for discussion. I know there were a couple questions we didn't get to, so Ms. Torres will kind of read those off, and I think between the two of us, we might be able to touch on each of them. And then there are also some comments on the discussion board that we'll get to if we have time.
Sorry, I'm here. So long story. So the first question, I know some of these were answered to some extent in the comments, but I did also want to have it on video as well. So the first question we had was, I'm curious to see how their work varied between natural, protected, rural, and urban areas, especially with respect to the issues at hand, the different involved and interested parties, what form of environmental justice takes place in these different contexts. And I know they touched on those with how there are different policies that address how water, sewage, things are protected, how permits are gotten, and to investigate each of those depending on where you are. And did you have anything you'd wanted to add first, Mrs. Grant?
No, I think that's a good summary.
So for instance, with protected lands, especially rural ones, there are supposed to be rules that do protect them, but depending on the administration and their environmental goals, that can be shifted. We know that's true with indigenous lands. Even if routes are better through non-indigenous lands, they do tend to go through indigenous lands for oil or natural gas. Urban areas, when we regard with environmental racism, even if the route is easier through a richer neighborhood, they will go through other neighborhoods. One good way is the highway. I've looked at the highways, and highways in Chicago, I noticed, I was like, that's not really practical, but that's also the case in New York. There was a highway that was supposed to go through Greenwich Village, but because Greenwich Village then and now has wealth and political clout, they actually chose a different route. You'll see that a lot of Black neighborhoods were kind of destroyed to make room for various highways. So that was the thing. Oh, so we continue. Oil and gas development, yeah, and indigenous lands. So those will tend to happen, even if, like I said, there's a better route. If it's through a better neighborhood or area, that will happen too. They will do gas or oil. They will do gas or oil pipelines to go through there, and they say, "Oh, this is safer," and it turns out it's not when the oil or things leak into, especially the groundwater, that's going to these indigenous lands as well. So even natural or quote unquote natural and protected areas are not necessarily safe, depending on who gets the permit, what exceptions are made because of eminent domain laws. So that's something to think about. Fun aside, if you are buying property and it has land attached to it, make sure you also get the mineral rights, because mineral rights are, so you as a homeowner, yeah, you have rights to the land, but mineral rights gives you the rights to the ground underneath your land, which some people don't know about. And then they find out, there's mineral or something on their land. And then that's how that works. So make sure you understand that, so that those things aren't happening to you in your area. So that's definitely one thing I've learned about through some of my work and some of my research on homesteading, and how homesteading has also become a controversial topic. So it's not just people on the quote unquote left or progressives that talk about environment and land rights. It is also people who live in very rural areas, very far from one another, because a lot of them do homesteading and they raise their own livestock. And so water and gas and oil are big concerns to them too.
Yeah, and I think the only thing I would add to that, the speakers kind of talked about this a little bit, but the three branches, kind of the three branches of government, as well as even just the silos in local governments, make it hard to work, in general. But then when you're working across state lines, or you're working within a context that includes the private sector, the public sector, residents, like it complicates the whole issue, right? So I think that was a great question, and I think, like, depending on what kind of area you're working with, what the issue is, who the actors are, your approach would kind of change or be dependent on who is a part of that.
And so our next question was about environmental racism, and that was from Randy. And so it was, can the speakers, which are here, speak about environmental ableism and how this intersects with environmental racism and or the work they do. So there's a difference, especially in disability, between impairment and disability, right? So impairment is perhaps what you have. Maybe you do not have a limb, maybe you use a wheelchair, maybe you're blind or deaf, or some other kind of impairment, right? And then disability are the ways in which society itself structures disability, and the ways in which you do or do not have access to things, access barriers that are presented based generally on those impairments, but also based on how society treats those impairments and ideas around them. So that's more the social model. You can Google that. I'll talk a little bit more about that next week. But when we're talking about the intersection with environmental racism creates impairments. So when we're talking about not being able to breathe, you know, the air quality being different, and that affects your lungs. And so now you have COPD or you have asthma. I'm from the South Bronx. They were still burning garbage when I was a kid. So much so that my sister, who was born 12 years after me, has severe asthma. We are surprised my brother doesn't have asthma, but he has skin issues because of the air quality. So because of that, right, and it causes a lot of impairments, a lot of underlying conditions that lead to other chronic conditions. And these areas typically that these are in are also not very well accessed. Things are not kept up. Some of these buildings are so old, they're grandfathered in from the ADA, so they don't have to be updated. So you will have poorer neighborhoods that do not have as access that is good, and things that were accessible like curb cuts or streets, they're broken up and they're never fixed. So you will have curb cuts that are broken or non-existent, huge potholes. In the winter, there is something called, I believe it's called Walkability. I'm gonna type that in. There's a website, especially in the winter, those streets are not paved or shoveled properly. People have to go into the streets, or they fall over out of their chairs or their walkers, or there's issues with buses. So in places where you see this, you will also see environmental racism. You will see lots of, just like with Hillco is causing a lot of people who have breathing issues now, right? And now they're becoming impaired, and there are no services to help address that. So now they're going to be disabled. So those things work together. Those neighborhoods are generally not well kept up, so they're not very accessible. You will have impairments, and because of that lack of access, now you are disabled, and it is harder for you to navigate through your community and get the services you need, because the services you would need that would help you are also very sparse and far away from you. So those are the kinds of ways that environmental racism and ableism intersect. They are creating these issues that are not being solved socially, legally, and so they continue to perpetuate one another.
I think that's a great answer. I don't really have much else to add. I've done a little bit of work on walkability assessments, so I definitely agree with that. And like, even just thinking about, you know, our speakers talked about the root causes. The root causes of the environmental justice is also a root cause of inequities related to disability status and ableism. So they're not, it is connected, it's interconnected.
And the next question were, and they did answer this a little in the chat, would environmental factors then be considered, does the organization tackle any issues related to climate change and involving folks in it? I know they did mention it, like when they were talking about St. Louis, more rain, more extreme weather is going to exacerbate the problems that people are having with their environment. So I guess that's another way that they're interacting. Someone said, would the environmental factors then be considered comorbidities of the larger disease? Yeah, so a lot of times before, and they mentioned this too, sometimes they would say, oh, well, these they're not fully, a lot of organizations wouldn't fully focus on the problems. They would say, well, it's your lifestyle choices that are causing these comorbidities and things like that. Well, I'm not choosing to live near Hillco. I don't have a choice, right? I'm not choosing to live near this dumping ground. I don't have a choice. And more people in and out of the health field are recognizing that there are environmental factors that you cannot, that you can't lifestyle choice your way out of. I remember when I went to a doctor, I was actually at the doctor with my brother, and I spoke to a doctor. He had a chart about teeth, about children's teeth. And I said, what is this? He said, well, environmental factors get into the genetics of people, and it can happen within a generation. So if you live in a bad, a poor environmental area and you're pregnant, your child will have issues. Like we have seen a lot of children, again, the South Bronx, who have really bad teeth, or because their teeth were weak to begin with, because their parents were already sick, and they become sick because they're young and susceptible. So as they grow, that is just programmed into their bodies. And so we have to see them more often for certain things. And so I would definitely consider these environmental factors, comorbidities of larger diseases. And there was actually recently a case where they were finally filing a suit that this woman, she had a daughter with chronic asthma, and that was caused by the air pollution. It wasn't just, oh, you just were born with chronic asthma out of nowhere. It was caused by these particular choices that were made that you didn't have a role in, and then that's what led to your daughter eventually, dying. And then there's Black communities as well that were built on on bad ground, like poisoned ground, that also leads to the whole town being sick, or, and then they're more susceptible to these comorbidities because their bodies are weakened and more susceptible to them. And then we have the last one, how did they coordinate their efforts? And I know Olga, I'm sorry, I forgot to copy and paste. I know Olga mentioned a little bit of it by working with the local neighborhood groups and working together so that they can't sell one of you a bill of goods and one of you another one. But yeah, sorry, sorry, Mrs. Grant, I kind of ran away with that one.
No, that's good. Yeah, I dropped in the chat, like this idea of cumulative impact was mentioned in the talk, I think towards the beginning, and kind of this idea of like people are exposed to multiple things at once. Like it's not just poor air quality, right? It's like poor air quality, the quality of the education, transportation access, medical care access, all these different issues that, again, go back to the root causes that people are experiencing all at once. Yeah, so yeah, that's a great question, Amy. She put in the chat, how does excess vulnerability to environmental disasters, thinking about the Ninth Ward and NOLA, fit into the story? Yeah, I think it's like a really interesting question. And thinking about the way that our government is set up and the way that it functions, and what it looks like to invest in communities, right? So like even if thinking about like investing in healthcare in a particular community, that would look like making sure that everyone has insurance, making sure that there's a safety net for people that don't have insurance, making sure that there's transportation to healthcare organizations, like whether that's bus tokens or whatever, right? So if you're investing in the health system, it might look like that. So when you talk about investing in a emergency disaster response system, that would have its own set of preparations that our government should take in theory, right? So this might look like storm drains, putting up extra barriers to stop flooding, or different, I don't know, I'm not an engineer, but different mitigation measures, right, to make sure that doesn't happen. And so especially thinking about like coastal towns, and I think this also does go back to climate change in general, and just how the landscape is physically altered in the long term, and thinking about like coastal communities that are impacted by flooding, or specific communities are impacted by more and more earthquakes from pipelines being built or oil being drilled or whatever it is, right? So there's this lack of investment by the government because they really don't care at the end of the day. That's what it goes to. And when you choose not to invest in something, it's because they're usually investing in something else, right? So it's this decision-making process where they decide, I don't know, we can use Chicago as an example. They can decide to spend $40 million on the police, or they can spend $40 million on public schools. And it's never going to be like both at the same time. So that's an unfortunate, I mean, money makes the world go around, right?
I think another thing that I thought about was, so, I mean, y'all probably know about Hurricane Sandy that hit New York, especially Staten Island, really hard. And I was actually in one house, you know, that was completely it was across the street from my house that was completely demolished. So one thing is, a lot of the houses in that area are not going to withstand these factors, and they're just going to be gone, right? And there's not going to be money given to them or help them repair it to an adequate level, right? Because they were already built poorly, so they're going to only be able to be rebuilt poorly. But the houses that are there, right, they're going to need to be completely gutted. And that was one thing we were doing, down to the foundation, right, down to the wood, because there's so much rot in it. But can they afford to do that, or can they afford to do a patch-up job? And now there's mold, and there's dust, and there's dirt, and there's all these things. Yeah, exactly. There was a lack of investment in the pipes, but also they switched to a new testing company because they wanted to switch to a different water source or something like that. And that company didn't test stringently. But yeah, so we're talking about these houses, right? In what ways are these houses being rebuilt to be adequate to withstand these disasters or not withstand these disasters? And how are these people being displaced? Because now you're homeless and you're more vulnerable to other types of diseases and illnesses. Like, there are homeless people getting Legionnaire's disease, right? They're getting things like versions of the plague, right? So now you are more susceptible to the environment, to the elements. And even if you, again, rebuild your home as best you can, if you're using this foundation that has issues, you're going to have issues in it too. So I think that could be, and you can look again in other areas, when something's being built, when something's being rebuilt, the kind of land it's built on. Those are all really important factors when we're talking about environmental justice. Also, again, environmental ableism, environmental racism, and all of those things kind of circulate together.
Yeah, I think one of the questions on the discussion board was about the question was, when does the focus need to be on halting additional harm, or are there ways to reverse some of the damage that's been done to the environment in these neighborhoods? And I thought that was such an interesting question, and thinking about, like, what would it look like to go from just stopping these bad things from happening to actually like reclaiming the land, revitalization, all of that. Yeah. And I think that that's definitely not as common, or at least right now, but I know there are some efforts to think about, like, what does it look like to make this community a sustainable community, and one that is not a victim of environmental justice, and kind of turn that on its head. I'll drop a link in the chat. I actually went to this presentation yesterday about an organization that is developing a food waste recycling facility on the south side, and it's going to take up like blocks of the city, and they're going to be collecting food waste from like public schools and different places in the community, and actually turning that into like renewable energy, and composting it, and doing like urban growing and like all that stuff. So I'll try to find that link and put it in the chat, because it's really amazing to like think about, like, what does it look like for I think the speakers talked about like the communities knowing what the solutions are and having that lived experience. Like, what does it look like for these communities, for communities to really like claim that, and also to have the power to be able to do that, right? Because it requires it requires that money, it requires that investment. And so, yeah, I'll drop that in the chat. And I know we're at time. It goes by so quickly. But if anyone has any kind of like last questions that are burning a hole in your pocket, so to speak, feel free to drop those in the chat. Ms. Torres and I can hang on for a minute if you need to, but otherwise, thank you so much for hanging in with us tonight. Feel free to reach out if you need anything, if you have any questions. We're here to help you succeed in this class.
Yep.
Thank you. Have a good night.
Night.
Thank
I'm sorry,
you.
Mrs. Grant, what was that thing you said you were going to drop in the chat?
Yeah, I'm trying to find it. You know, I'm one of those people that likes to keep tabs open for like a week. And so I had them open and I was like, let me finally close these. And now I regret it.
My
but
sister
hasn't
has
opened.
almost 200 tabs open on her MacBook, and I don't. I close all my tabs every night. I shut my computer down completely. Oh, we're so
Yeah.